Wow. It's like, you know how it is, Daniel, check against delivery. I like books. I like them a lot. I like basketball more, but we have WorkSafe here, and Daniel wouldn't put up a hoop on stage. And so I'm going to start. I'm going to read a book. You know, many of you will know this book, of course. It's kind of a national, international bestseller by Atul Gawande, which is called Being Mortal. Writes a little bit about long-term care and raises issues that I know you care about. And so I thought I'd start with a quote from the book. And I got to get to the right page. That's key. He's talking about, in the United States, about care homes, of course, and some of what he says applies to Canada, and some of it doesn't. I'll let you judge how much this applies. This is the consequences of a society, he's talking about the challenges in long-term care, that faces the final phase of the human life cycle by trying not to think about it. We end up with institutions that address any number of societal goals, from freeing up hospital beds, to taking burdens off families' hands, to coping with poverty among the elderly. But never the goal that matters to the people who reside in them. How to make life worth living when we're weak and frail and can't fend for ourselves anymore. I was reflecting on that. There. Because, of course, giving a speech today, and I was thinking, what am I going to say about long-term care and assisted living and home care and home support with Isabel McKenzie in the front row? What can I possibly say? Because, of course, first of all, it requires footnoting. Careful and assiduous footnoting. But also, all of you in the room have this experience, live this life, love this work, believe what you're doing is fundamentally important, as I do. But what do I have to say? What can I contribute to that discussion? And one of the things that I looked at as I was reflecting on it, you know, all the notes, 3.36, there are 883,000, or there will be 883,000 seniors over 75 in 20 years, which is 250% more than there is now. The 65 numbers are interesting. The 75 numbers are shocking. List the numbers off. And you talk about statistics, and you talk about the need for more care aides, and more LPNs, and more nurses, and more support workers. You talk about all of those things. And I had written down a bunch of things, and of course nowhere on there were people living in long-term care. And so I wanted to start today for my own purpose and for ours by thinking about that and thinking why we need these things, why it's important, why what you're doing is important, what we're doing is important, what we're talking about is important. And of course it starts with something all of us face, the fact of aging. The fact that when we talk about aging, we talk about seniors in political debates, too often we contribute to an ageism that comes with referring to people only as a problem, or that word that surely we all hate by now, a challenge. And so I wanted to start there. I wanted to say how honored I am to be here in the territories of the Coast Salish people with an extraordinary audience. I want to thank Karen and Daniel and the care providers for all the work they were doing. I saw Karen out in Abbotsford last week, and the extraordinary work that she does at her care home, and a lot of you do everywhere in BC. I wanted to acknowledge a couple of opposition MLAs here. I have to say, over lunch I did a small survey about my speech, and about 14 people came up to me and they said, well, we got to leave before the speech. And I was the opposition health critic for a while, and Mike Bernier, who's here, and I think hopefully some of you will get to know, it was Minister of Education, and he was the mayor of Dawson Creek. And you know, I was health critic and an opposition member for quite a long time, so I appreciate the institutional role of the health critic and how important it is and how good it is to have someone of such high quality such as Mike in that role. But of course, as Minister of Health, I kind of prefer a weak critic. I'm just saying. Tracy Reddy's was here. She's MLA, new MLA, Liberal MLA from Surrey. Hopefully some of you got to meet her. She was an executive in a credit union, then she made the choice to become a member of the legislature. Makes one a little bit concerned about the choices she made with our mutual fund. But she's an outstanding person, and I'm delighted that she was here today. And it's great to see people here from healthcare unions. I saw Jennifer Whiteside, and you know that the Hospital Employees Union, really on behalf of everyone in the room, has been doing an ad campaign recently, and I took a rare afternoon off on Sunday to watch the NFL playoffs, desperately hoping New England would lose. They did not. I don't get the result I want all the time. But during that time, it's like narrowcasting. There's broadcasting, there's narrowcasting. 5 times, count them, 5 times. Well, the Minister of Health was watching the NFL. There was an HEU ad about seniors' care right there. Hard to get away. It's as if you knew. Sherry August-Laura is here from the BCGU. She's also on the board of the Provincial Health Services Authority. I'm so proud about that. She's here today, and Christine Sorensen's here from the BCNU there. And we have people, of course, from Denominational Health, and I'm so appreciative of Paula from McKesson and her introduction. I also want to acknowledge Inderjeet Hundal, who's a new member of the Fraser Health Board, who also runs, I think, one of the most impressive and innovative assisted living facilities in Surrey. And I really recommend you talk to him about some of the work he's done in culturally appropriate care, because it's really extraordinary what he's done, and I'm so honored that he's serving on the board of Fraser Health. So there it is. I also want to say that there's some people that technically work for me here. I'm really hoping for that, you know? I'm going to test that out during the joke portion of the speech. Sharon Stewart from the Ministry of Health is here. Mark Armitage spoke this morning, and I have a question for the audience. Did he, because I'm usually a hands-off minister, but, you know, I sometimes try and help out the team, you know? So I wrote jokes for Mark this morning, and I want to know if he used them. Mark, did you use my jokes?
I didn't want to upstage you, Minister.
Good answer.
So I wrote a joke for Mark. I tweeted it this week because my ambition after I leave here is to write jokes for Christmas crackers. You know, I feel that's an industry that's going to grow. So the joke I wrote for him, which he refused to give, apparently. What do you call a hairy simile? A metaphor. It's a thing. I know what you're saying to yourselves. I can't believe this guy wasn't elected premier. It's good to be here to talk about seniors care and to see what you're all doing together, because what's exciting about this meeting is that it's a collaborative, and what's necessary about what we have to do together is to work together. We face some real challenges. Daniel referred to it this morning. You know, he didn't write me any jokes either. That we raise a lot of serious problems. The one I referred to earlier, the enormous growth of people over 65 and over 75 is, of course, both a problem and an enormous joy for all of us in our lives. Situate ourselves now. I'm now 53, and it's a different vision of life than it was when I was 33. All of these questions are coming, and they're coming too fast. We have an enormous increase in that. When we started public health care in Canada, we had less than 20 million people. We now have 35 million. and life expectancy was 10 years younger than it is now. When you think of when people criticize the public healthcare system, and talk about the seniors care system, and talk about what we do, we should put that in context. Life is better because of the public healthcare we have. And our lives are better because we live longer. This is not a problem, but it is something that we have to face together. So, you know the statistics. Isabel, I thought you'd be gone by now. About 880,000 seniors over 65. That'll be in approximately 15 years, about 1.4 million. And the statistic I talked about earlier about people living beyond 75, who are in some ways the core group for both long-term care and assisted living and home care homes. So that's a huge and significant challenge. It's a huge and significant challenge because healthcare also occupies a very significant share of government spending already. It depends on how you add it up. It's about 42% overall. There's a 46% statistic. You take a debt servicing, it gets close to 50% of our overall spending. And we want to invest in other things. We want to invest in childcare. There's a whole incremental area which has been underserved in the past about mental health and addictions, and we're facing that as a crisis now. There's a housing crisis in the city that affects everything we do and has become the subject, the one subject you hear about everywhere, whether you're a renter or a homeowner or whoever you are. There are all these issues that require investment, and then you have an inevitable demographic growth in healthcare spending, which also already occupies between 40% and half of the government budget. And then you have the existing situation. We have 28,000 people roughly in long-term care, living in close to 10,000 of that are in publicly run facilities. The rest are in contract facilities funded by the government, 28,000 funded spaces. And we know the facts of that. If we were listening to the ad, if we were reading Isabel's report, there was a report, I think it was the 2016 one, and I could stand to be correct, which said roughly 90% of care homes did not meet the standard in terms of staffing. This isn't a new problem. The government was aware of this in 2008 and 2010, but Isabel's report and the work that was done by lots of people in this room, advocates in this room, in particular the labor movement, but others, put pressure on the government for change. But I think we would all accept that not meeting the standards that we set, which are actually lower than some other jurisdictions in Canada, is not acceptable, and we have to address that, and the government was under enormous pressure, and I'll get back to that later when I talk about the money. But the other thing we need to reflect on is that that's the existing group in long-term care. And that if we know anything from the numbers, no matter how successful we are in advancing, and we're going to do this as well, home care and home support, that number is going to grow, and it's going to grow significantly in the coming period. And some people have suggested to me, someone did at a town hall meeting in Sydney of all places, where the number of people over 75 is going to get much, much, much larger than that as a percentage of the population. But there's going to be something like this, whereas you're going to build for a short period of time and then it's going to go down like that. That may happen in some provinces in Canada. That will not happen in British Columbia. So the challenge is the growing demographic, and then the challenge is the current demographic and our current staffing levels. The challenge is to meet future staffing levels. And that, of course, is going to require two things that I'm going to talk about a little more. And the first is what you're talking about today, and that will require an enormous effort by all of us and a lot of people beyond this room, which is finding the people to provide care to our parents and our friends and ourselves in future, and celebrating that work and respecting that work in such a way that people will want to do that work in the future. There are other challenges. I think
Daniel, in your presentation, you talked about competition, about from reverse mortgages. There's competition from a new childcare program, which will be in some ways reaching out in some of the same areas to the same people that you'll be reaching out to as we try and meet our care standard goal. Well, there's all these challenges. And I'd say fundamentally beyond that, they're the following. One, too many people who work in the sector are part-time and casual. 51% in long-term care, 52% in home care and home support. And that is, of course, an opportunity, but it also is hard to recruit, especially in a lower mainland community, or Metro Vancouver community, they call it now, which is getting bigger and more expensive. That's the work that's being offered. Two, and it's a central question, the quality of the work has changed. I had spent New Year's Eve with some friends of ours who are carried and work in Burnaby, and we talked a little bit about this in between the karaoke. Don't worry. And they told me about the realities of their workplace, which is the growing acuity of patients, the growing pressures on them, the very staffing shortage we're talking about, leading to jobs that have both high rates of violence and high rates of injury. Right? Put that on a pamphlet for recruited carriers. Part-time work, high rate of injury. That's a significant challenge. And third, I would say, and I say this with great respect, because there has been political debates about these things in the past, but the insecurity of the work, the nature at times in some care homes of contract living has led to pressures on the workforce. And whatever one thinks of that debate, and you know I have a strong opinion about it, in the past, what we know now is that in this employment market, we have to make these positions more attractive. That is a policy I suggest to you, that if it was a good policy, Bill 29, which I didn't support, is not a good policy in 2018, when we need to recruit more people to the sector. We've got to say to people that these jobs, all of them, at all levels of care, whether they be care aides or nurses or administrators or others, that these jobs should be jobs that people should want to spend their lives doing because they are of such value and that we value the work that's done. So that's the first set of things. That's the challenge, right? And over the next little while, and Mark talked about this, I think, this morning, we have to work together to both find the positions, but also find the workers. And that means training more people, and that means transforming the work, more of the work, from part to full-time. And we have to be part of that and partners together on that. So, let me come to the good part, the money. So, all of you heard, I assume, an announcement in March of 2017 by the previous government. They promised $500 million. Sorry about you, but when round numbers go with a promise, I get a little worried about that promise, I think, but you feel that it might have been written by the communications people, it's not by the people actually, finding the money. This was done after a lot of the significant work done by Isabel as senior advocate, but also by, as I said, a lot of the people in this room. And everybody knows, I think, that the government had been in office at that point 15 years and 10 months and was facing a provincial general election. And I'm not going to dwell on the political today. And generally, I'm not going to dwell on it on other days, because these things don't deal with the realities that we have to deal with, which is to improve things. Right? But they made a promise, a $500 million promise that was excellent. It had ideas, the press release was superb, the minister presented it well, it was all fantastic, the stakeholders generally speaking, liked it. There's only one small problem with the $500 million promise. Can you guess what it is? There wasn't $500 million. These things happen. They happen and they make people cynical about politics, and that's a problem for me. But we have to not worry about that. We have to find the resources, find the money. That's my job as Minister of Health. The election's over, we have a new government, and we're going to act to fulfill that over the next little while, and it's not going to be easy. Why didn't the money exist? Well, there's two reasons. The federal money cannot be used on long-term care staffing. Cannot be used. And that's $275 million of it. Now, to be fair, it can be used on home care and home support. I'm going to talk about that in a second. So it's not gone away, but the promise of the 3.36, that promise can't be fulfilled using that money. You have to find other money. And secondly, there was $20 million of provincial money in that this year, and that was the only real money there was. Because the provincial government did a 3-year plan in its budget that promised a big increase in the election years and smaller health increases in future years. And so there was no money in 2, and there was no money in 3. So my task, because I think we have to do these things, I think we all agree we have to do these things. I think if you're in the political realm, NDPs and Liberals and Greens all agree we need to do these things. You agree we need to do these things. Seniors do. Everybody does. We have to find the money. And that's what I'm working on. That's my task, in part with your support. And we're going to start on that process now. But it's a real thing. It's a real challenge. And I think we're going to get there. So what does that mean in the short term? It means that the plan, which had $27 million in federal money this year and $20 million in provincial money, it has been rolling out in small ways. The money has been in small ways on some things that the ministry and others have done in the last little while. And I haven't paid any attention to this crucial moment in the speech that Isabel is leaving, because she has to get a plane. I haven't paid I am not going to draw attention to the fact that at this crucial moment of the speech, she's leaving. But we'll let that go. And give a big hand to Isabel McKenzie. Where was I? We're going to start the first year of the federal money on improving hours, and we'll be rolling this out in the next few weeks, and you'll get specific details. Not fancy announcements, not $500 million announcements, not me on stage with things flashing behind me saying they're great, but actual concrete proposals that hopefully will help many of you in the work that you do. So we're going to start in home care and home support on that side of the equation by improving hours, by something that Isabel really, really cares about, by providing some support for respite care that hasn't existed before, and improving, in general, access to home care and home support, particularly for those who are trying to avoid a return to acute care, who want to delay going into long-term care, or who have complex chronic diseases. First set of things for home care and home support. It's significant, and we're doing it now, because when you have smaller amounts of money, you've got to launch into a process. You keep spending it, even after the fiscal year ends, you spend it, so that's why we're starting on that now. And then there's the provincial money. Starting next week, you're going to hear on the provincial money some new resources to hire people in long-term care, with a particular focus at the beginning, because it's the easiest thing to do, to the transitioning people from part-time and casual to full-time work. I'm going to start to do that starting now, and then go step by step throughout the next couple of years. And it is a huge task. It would be a huge task to stay at current levels, right? I think we all know this. The status quo is a huge task in terms of recruitment. But we need to be 3.3 to 6, about 900 care aides, about 300 LPNs, about 165 registered nurses, about 50 allied health workers. See, Isabel isn't here, I can just ring these things off, you know. And about 100 other workers in long-term care to meet the 3.36. We intend to do it together. But it is going to be a huge task. And the health human resources work you're talking about, the little over 1,000, for example, care aides that we train every year in our 14 public institutions, we've got to do better than that. And like I say, we've got to provide better security in the workplace by moving part-time work to full-time work. There's a lot more to say. I give long speeches. Am I past my time today?
You're good.
He said I'm good.
You keep talking.
He wants me to keep talking about the money, you see. But, so that's where we're going. And you're going to see it, like I say, starting next week. And the details will flow from there, and it'll be progressive, and we'll move forward through the time. And the other place I think it's going to start in terms of care homes are some of the care homes with the lowest ratios now. We'll be given some priority in that system, but right now we want to get to work, obviously, on filling positions now so that we're making progress. Northern Health, and so some of what we have to do is to adjust the differing needs of the different health authorities. People who are in Northern Health knows this. They've met the 3.36. Generally speaking, it's more public care there. In general, as a percentage, they're at the 3.36 now. And so we will be obviously investing in the North as well, though the priority will be slightly different. So that's where we are. I know that on the agenda there were questions. What I'm gonna do now is I'm gonna finish because I had a talk at the breakfast table this morning with my wife Renee. And I told her what I was going to do, that I was going to start. I was going to read from this book, and my wife is a poet and a writer. And so when I said, and she writes books, so when I said I'm going to start a speech by reading from a book, she said, oh yeah, read me what you're going to read. And then she said, after she heard what I had to say, she said, maybe not for a breakfast. Maybe not for a lunch. She was questioning that. But as a tribute to her, you know, I'm going to finish by saying that the ideas that Dr. Gulandi talks about in this book are not new ideas, of course. And so I'm going to quote a little bit of poetry. How's that? People know Ulysses? Do people know poetry in here? People have heard of Tennyson? Some people have heard of Tennyson? You know, not as many as I'd hoped. I was hoping kind of to lead a thing. And I often quote this thing, and every single time I've quoted it, I got something wrong. And so I wrote it down today. How dull it is to pause, to make an end, to rust unburnished, not to shine in use, as though to breathe were life. See, this isn't new, and it's not a new discussion, because we all know that the healthcare system, all the work we do, often is dedicated to the avoidance of death, not the quality of life. And that's got to be, I think, especially in seniors care, especially now, especially as more of us are going to live longer as seniors. It's got to be our focus as well. Not just meeting care standards. Those are important. Those are vital. Those are fundamental. Not just ensuring patients are safe, but that they continue patients, residents are safe. People in long-term care are safe. People in the community are safe. Of course that's important. And nothing that we should say or do should indicate it isn't. But we also have to find ways in our system, and I'm committed to working with you to do this, and I know you're committed to the same thing, to ensuring that life is more than breathing in the 21st century, and that people can live the last years of their lives expressing their freedoms and their hopes and their aspirations. Thank you for having me here.